Thank you. Thank you very much for inviting me to present. This is a report by IPES Food we've been working on the past almost 2 years on the health impacts of food systems. And this was a work commissioned by the Global Alliance for the Future of Food and Farming. If I were to say what is the main message of the report is coming out in October, so I hope to give you a little preview and raise your interest in looking at the report when it comes out. The main message is that the food systems are making people sick. And I think we heard this a number of times yesterday at dinner time. And it is throughout. It is how we produce, distribute, market, prepare, eat, and dispose of food. It's costing us. It's costing in terms of public health. It's making people sick. Now, what we have done in the report is to look at how this is happening. And we grouped the impact of the negative impacts, health impacts of food systems into 5 major channels. We looked at how people get sick in terms of occupational hazards, environmental contamination, compromise on contaminated foods and livestock, unhealthy dietary habits, and insufficient diets. We hope by grouping those into those 5 main channels, we have covered most of the negative impacts that we see in health from food systems. The first channel is occupational hazards, and this is sometimes forgotten when we discuss the health impacts of food systems. People are getting sick because they work under very unhealthy conditions worldwide. And one of the data that we provide there is that pesticides are responsible for an estimated 200,000 acute poisoning deaths each year. Now, what strikes us as quite significant in this data is that 99% of those are in countries in the South. So some of the pesticides that have not been used in North America or Europe continue to be used in countries of the South. And some of the regulations that we have in northern countries are not used in countries in the South. So that's part of the situation. The second major channel of health impacts that we have is environmental contamination. And in many different ways, the food system is contributing to environmental contamination. So people get sick because of contaminants in the water, air, or soil. And one of the data that we have used is that there is some estimates that up to 33% of greenhouse gases now is coming from the food system, not just from agriculture, but throughout the system. The third impact is that people get sick because they eat contaminated food or foods that are compromised in some ways. In 2010, there were an estimated 600 million cases of foodborne illnesses and 420,000 deaths worldwide. Estimates. Another major channel of health impacts is our diets. People are getting sick because they have unhealthy diets, and we heard quite a lot about those here. One of the data that we use from one of the studies suggests that, according to this study, obesity has roughly the same economic impact, about $2 trillion as smoking, or the combined costs of armed violence, wars, and terrorism, just to give us an idea of what this is costing us. And finally, the last channel of impact is the insufficient diets. People are getting sick because still, 21st century, they can't access adequate food at all times. So this is the question of food insecurity, hunger. 2 million people worldwide suffer from micronutrient deficiencies, and nearly 800 million suffer from calorie deficiencies. Okay, so this is just grouping the health impacts that we have. But we find that we know what is leading to those health impacts. It's not that we don't know. I think we have enough evidence of it. And those are the main reasons for those health impacts: chemical-intensive monocropping, intensive livestock production, mass production and marketing of ultra-processed foods, and development of deregulated and dangerous supply chains that put people working in the food system in danger. So if we know that, why aren't we doing enough? And what is the reason for the policy failure that we have? And the policy failure that we find goes from omission to inefficient policies to policies that have perverse results, that instead of helping are making things worse. So why is it? So we kind of identified three main factors in that situation, why this is the reason. One is that we still have lack of evidence in a number of cases. There are some blind spots, in particular when it comes to the situation in poor countries or for populations, marginalized populations in more developed countries, rich countries. For example, the indigenous populations in North America. We need more evidence, more research on those blind spots. The second factor is who shapes the terms of the debate. Who do we have in the room? Who do we have helping deciding? Here we identified the impact of big food industry in terms of not only through lobbying, but also in terms of affecting science and even practice. And certainly, we are hoping to have more allies in the food industry in terms of moving things forward in that aspect. And the third component is the simple complexity of this whole thing. It's difficult to deal with complexity. All of those health impacts actually are interconnected and mutually reinforcing. And also, the complexity is compounded by climate change, poverty, the health care systems that we have. So it's difficult to deal with complexity, but it should not be an excuse. So those are some of the components we find lacking to move things forward. So I hope that this created a little bit of what we are hoping to have in the report. The report will come out in October, and in the report we hope to propose some leverage points to move things forward. And I thank you very much for inviting me, and welcome you to read the report in the fall. Thank you.